Good afternoon, everybody, and Happy New Year. It's Dr. Michael Jacobs at the Fertility and IVF Center in Miami, wishing you the best in this new year. This afternoon's brief topic is meeting your fertility goals in 2021. And most of our patients are trying to get pregnant, and obviously they'd like to get pregnant as quickly as possible. So the best way to approach it is really to set some goals to meet, to follow through with treatment, and to try and figure a way for us to help you in the best way we can. The basic premise of fertility evaluation when a couple comes to us is for us to try and figure out what the cause of the problem is, whether it's a male problem such as a low sperm count or low motility or low morphology of the sperm, or whether it's a female-related problem that's related to either a disorder of ovulation, a problem with anatomy such as an abnormality in the uterus such as fibroids or scar tissue in the cavity, or polyps, a blocked tube, or whether there's a problem with ovarian reserve, which is the quality of the ovary and the number of eggs that are present in the ovary and how responsive and sensitive the ovary is to fertility drugs and how easy it may or may not be to get pregnant. So, the first thing we do is find out what's wrong. A lot of times we have a little of this, a little of that. Sometimes we have a specific item to point to. But the first step in meeting one's goals is to figure out what's wrong. In patients that are thinking of fertility preservation, then the basic evaluation is just to look at ovarian reserve to see if this makes sense based on age and ovarian reserve, that you're going to respond to fertility drugs and that we're going to be able to achieve our goal of preserving fertility. But the hardest thing for couples to get over, and I think that a couple of the major stumbling blocks that face every couple are one, being committed to the process of finding out what's wrong and letting us help you get pregnant. Most patients come to us after they've tried for a while. Some people come just trying to figure out what's going on. We want to know where they are in their fertility spectrum, basically. But our goal is focused on finding, is there a problem? If there is, we focus our treatment specifically on that problem. And if there isn't, then we treat unexplained infertility. And the stumbling blocks that occur don't really change year to year. The stumbling blocks are, one, coming to the realization that you need some help. And that's what we're here to do. We've been doing this for 30 years now. This is our 30th anniversary of serving the Baptist community in South Florida and helping thousands and thousands of patients over the years achieve their dreams of having a baby and helping them get pregnant. From a practical side, nobody really wants to be our patient. They'd rather get pregnant on their own. And we understand that. We're sensitive to it. We will try and keep things natural when it makes sense. But the reality is that things aren't happening naturally. Things aren't happening the way they should on their own. And most of the time, we need to intervene to help increase the likelihood of a pregnancy occurring. So the first step in meeting one's fertility goals is really appreciating the fact that things aren't happening on their own, and to acknowledge that there's nothing wrong with that. It's just a matter of nature's not working in your favor for whatever reason, and we're here to help make the system work as best as it biologically can. We're trying to outfox it sometimes by getting better eggs to be produced, or getting you to ovulate when your ovary doesn't want to ovulate, or getting eggs to fertilize in a dish when they don't want to fertilize naturally. But the first step is going, okay, this isn't happening on our own, let's get some help. And when you come to us, we're going to first find through your history, is there anything obvious that can explain this? And then second, what do we do about it? So if you acknowledge that, okay, I'm not getting pregnant on my own, I need some assistance, then we can be beneficial in that regard. And then the second step really is, let us help you. If there is an issue, you need to share with us what your limitations are. In general, we're looking at a complex system of reproduction, but the treatments are really pretty straightforward. If you're not ovulating, we'll recreate ovulation with the assistance of fertility drugs or ovulatory drugs. If the sperm's not working, we'll try inseminations to try and get the sperm closer to the eggs at the time of ovulation. And if the sperm is moderately compromised, then certainly something like IVF is going to make more sense. But the two basic ways we have to treat patients that are ovulating otherwise are with ovulatory drugs combined with inseminations, so-called artificial insemination or intrauterine insemination, and the other is in vitro fertilization. The latter is when you stimulate the ovary with fertility drugs. You can aspirate the eggs from the ovary, fertilize them in a dish with injecting a single sperm into a single egg, let the embryos develop for 5 to 6 days, and either transfer the embryos at that time, cryopreserve them, or consider freezing the embryos after biopsying them and waiting for the biopsies to come back to make sure that the genetic material of the placental cells, which we biopsy on the outside of the embryo, are acceptable for an embryo to be transferred and increase the likelihood of a successful outcome. But the second part of this is, let us treat you. And what are the limitations for treatment? The limitations are usually, one, what's insurance going to cover and not cover? If they don't cover things, how expensive are different treatments? It's important to look at the outcome of different treatments relative to how much they cost, because sometimes things that seem like they cost more actually are less expensive because they work so well. And you don't have to do them 30 times to get a pregnancy to occur. If something occurs 1 out of 2 times rather than 1 out of 12 times, it can be a little more expensive and it's still much more cost effective. So, the obstacles, one, psychological barriers. I don't want to be infertile. I don't want to go to the doctor. 2, okay, I am now at your office. Now this is what's not going on. This is what I need to help you with. Let us help you. Let us help you within the confines of what your financial limitations are, what your ethics are, what you feel would be an appropriate treatment or not. So it's important to have a two-way conversation with us. There's nothing to be embarrassed about, whether you don't want a specific treatment or don't want to consider something because it just feels wrong to you, or religious-wise you don't agree with it, or financially I just can't do that, although I wish I could. And we'll try and devise a treatment plan that meets your goals and increases the likelihood of you getting pregnant. The best way to get pregnant is to follow our recommendations as best possible, but we also respect each patient and each couple as an individual to help guide us through that process. So, those are really the key factors. One, come on in and let us talk to you. Let's find out what's wrong. Set some goals. What are we going to do this year? Are we going to come in and find out what's wrong and go, okay, I waited 2 years, maybe something else will happen. If you're unhappy that you're not getting pregnant and it's not happening in a timely fashion, we'll tell you if it doesn't make any sense to treat you. If you're 33 and you ovulate, you get a period once a month, and your husband had a previous pregnancy in another relationship, you probably don't need much of anything done. But if you've been together for 5 or 6 years, nothing's happened, waiting another 5 or 6 years isn't going to improve things. So, the first step is acknowledging, yes, I need some help, and that help is one. The first of our goals is to help you figure out why things aren't happening in a timely fashion, and the second is to devise a treatment plan that makes sense medically and that makes sense to you from both a personal standpoint, a financial standpoint, and a getting you pregnant standpoint. Important to keep in mind that we're both on the same page. We want to get you pregnant. We want to get you pregnant in a timely fashion. We want to get you pregnant without complications. We want to minimize the risk of multiple births. All these things are what we do all the time, and we want to do this in a way that just makes it easier for you. We often will see patients that benefit from outside support systems, whether it's a psychologist who helps with developing stress-reducing measures, or acupuncture, which just basically patients feel helps them relax and in some cases may improve fertility for reasons that aren't totally clearly defined, but a lot of patients feel it's beneficial to them psychologically. So we try and do all this stuff for you. We try and get you treated in a cost-effective manner, and we'll outline what to expect and what not to expect. The key of not being too disappointed is to realize that nothing we do is 100% successful, and how successful we are depends on what we're working with. If we have a normal uterus, sperm, and good quality eggs, most of those patients get pregnant. If we have patients that have very limited ovarian production of eggs, that are older and are insistent on using their own eggs, we're not going to see very high pregnancy rates. So it's important to understand the options. It's important to set goals. What are we going to do? When do we move on to something different? If we're going to start simple with inseminations, then if it doesn't work, how many times do we do it before moving on? So the whole process is just really for us to be there to support you, to develop a treatment plan and get you through it in a timely fashion. Most of the time patients are already frustrated by the fact that things aren't happening naturally, things are taking too long. Once you come to see us, we get things done real quickly. We will evaluate things within a cycle and sit down, map out a treatment plan, and then proceed with treatment. Obviously, we are very concerned about COVID, as everybody is, and the key here is when available, we certainly encourage and recommend patients to consider getting vaccination. We do Zoom consults, telemedicine as best we can. Certain times we have to examine you. When you're in treatment, we need to do ultrasounds and blood tests, and we do our best to make the office a safe place for you and a safe place for our employees. So we'll do our best with social distancing. We'll do our best to minimize the need for you to travel, come into the office as best we can. We certainly recommend that people get vaccinated when available. And in patients that are undergoing treatment with in vitro fertilization or frozen embryo transfer, in that subgroup of patients, we do require COVID testing. The IVF is the fact that egg retrievals are done with sedative anesthesia, and anesthesia is very adamant that patients be negative before they give them sedation. So we usually, with an IVF cycle, we'll test somebody before they even start fertility drugs, and again a couple of days before the egg retrieval. With frozen embryo transfers, we do one test before getting started, and again, it's just mostly to try and minimize the risk that a cycle has to be canceled because the test comes back positive. You don't have to wait to get vaccinated to get pregnant. The key is just be smart. If you are going to undergo fertility treatment, if you're going to be pregnant, then you do need to social distance. You do need to wear a mask. You do need to minimize your contact with other people as best possible and keep your bubble as small as possible. All those things are important. The key is, if you have questions, ask. We're here to support you. We're here to hope you meet your goals. But I think it pays to sit down as a couple, husband and wife, or a partner, whomever it may be, and just sit down and go, what do we want to accomplish this year? What do we want to do? Are we going to drag this out for another 6 or 12 months or another year or two? Or do we want to just sort of hit it on the head and go, okay, we want to have a child, we want to do it now. Let's find out what's wrong, let's find out what we can do to fix it, and let's go ahead and do treatment. If we're recommending something that doesn't make sense to you, if it's financially too expensive, or insurance isn't covering it, or whatever, you got to let us know. Nothing wrong with that. We'll try and do the best we can within the confines that we have, and we will treat you as best possible. But the main key is, the more people that go through treatment, the more patients that follow our advice and recommendations, the more of them are going to get pregnant. So we're here to help you. We're here to support you psychologically as well, and we're here to help you create a family, as we've been for 30 years and will continue to be. So have a good, safe New Year's, and wish everybody well. Starting next week, we'll pick up some individual topics again on a weekly basis. I look forward to chatting with you for short periods on Monday afternoon. And be well, have a good New Year's, and stay safe. Take care.